My name is Jesse Kharbanda, the Executive Director of the Hoosier Environmental Council, Indiana's largest environmental policy organization. I'm speaking to you from the Richard M. Fairbanks School of Public Health at IUPUI in Indianapolis, and I'm going to be moderating a panel on environmental public health, specifically looking at prospective 2015 legislation and how it might have bearing on environmental public health. Let me begin by saying that we're all incredibly proud of Indiana's manufacturing and agricultural heritage, which has not only produced goods and food for use all across the globe, but which has provided countless jobs to Hoosiers over the decades. But the flip side of the very intensive way we make goods and food in Indiana can potentially contaminate our air, land, and water, and at levels that make things unhealthy for people, especially for kids, the elderly, and for people with chronic illnesses. The goal of our panel today, which includes Dr. Indra Frank, Environmental Health Director for the Hoosier Environmental Council, and Tim Maloney, Senior Policy Director for the Hoosier Environmental Council, is to walk through 4 specific issues related to environmental public health. We'll start off with a brief discussion related to the top environmental health challenges facing Hoosiers. Second, we'll talk about a possible piece of legislation related to a regulatory moratorium. Third, we'll discuss legislation that is called No More Stringent Than, that relates to the power of the Indiana environmental regulators to enact on their own policies that safeguard public health. And finally, we'll talk briefly about the budget. We are fortunate that we will hear concluding remarks by Dr. Stephen Jay, distinguished physician, public health scholar, and someone who's played a vital role in the public health community in Indiana and at large to elevate awareness of public policy and its repercussions for public health. So with that introduction, let me dive into the questions to our panelists, Dr. Indra Frank and Tim Maloney. So we'll start with you, Indra. What do you see as some of the biggest environmental health challenges in Indiana?
Well, Jesse, the one that I might put top of the list is one that isn't specific to Indiana, but impacts all of us, and that would be climate change. We don't live in a coastal state, but climate change still has an impact here and an impact that affects public health in a number of ways. First off, it brings more extreme weather events, and flooding, of course, brings injury impacts to drinking water. Also, climate change is shifting the range of disease-bearing insects, and that shift has already started. Second, I would like to highlight the potential health implications of the vast quantities of untreated animal waste that are produced in our industrial agricultural facilities. The waste in and of itself is problematic because it goes untreated, unlike the human waste. We generate in this state many times more animal waste just by volume than we do human waste, but it goes untreated, so there's the potential to contaminate water. And then perhaps even more important than that, many of these animals are treated with antibiotics unnecessarily. The antibiotics are used because the animals are trying to survive very crowded conditions, and sometimes they're used as a growth promoter. They're not used to treat disease. Those antibiotics are leading to the generation of antibiotic-resistant organisms that could have severe consequences. There have already been a few individual cases of antibiotic-resistant infections, but the potential is there for very serious consequences down the line if we start seeing infections in the human community for which antibiotics will no longer have an effect. And then last, I would include lead poisoning on my list of environmental health concerns for a couple of reasons. We've seen lead poisoning rates in children come down dramatically as the result of public health-oriented regulation, and that's fantastic. But lead poisoning is imminently preventable, and once lead poisoning occurs, the damage is permanent. That child winds up with a lower intelligence than they would otherwise have had, and with behavior problems that they would not have had. The most recent numbers that are available for Indiana show that we had more than 700 children who qualified for Indiana's definition of lead poisoning. We had more than 4,000 children that year, and the year was 2011, who had blood lead levels above CDC's level of concern. And this puts a drag on Indiana's competitive abilities and our ability as a whole if we have children who are not doing as well in school as they could have. We're reducing all of our potential as a state. So I think those are my top three.
Okay, great. Thanks, Indra. So we've talked about climate change, confined animal feeding operations, and lead poisoning. Tim, do you have any additional thoughts about priorities for environmental health challenges in Indiana?
Thanks, Jesse. I'll mention a couple of additional issues that I think are very important. Number one, even though we've made a lot of progress in improving air quality throughout Indiana, we still have situations in summertime with high ozone levels that make our air quality unhealthy for Hoosiers, and in particular those susceptible populations like children and the elderly. And in wintertime, we still have days of very high particulate pollution, which also threaten Hoosiers' health and ability to be outside on those days and conduct their normal activities. Another topic I would mention of great concern to us, one of the consequences of our heavy reliance on coal for producing our electricity is the question of what we do with all the waste that's generated by burning coal. And this is a huge waste stream that in Indiana is very minimally regulated, and as a result threatens drinking water supplies throughout the state. And we've actually had 10 instances, known instances of groundwater contamination from coal ash disposal sites. And finally, I would mention another consequence of one of the items that Dr. Frank mentioned, and that's the risk of bacterial contamination from animal agriculture and from human activities. And one of the consequences of that problem that we see throughout the state is the ability of Hoosiers to recreate in our waterways, to go swimming or boating, and that risk is generated by both high levels of bacteria in our waterways, as well as the stimulation of blue-green algae growth, which again can make our waterways safe to swim in. We still have warnings on our Lake Michigan beaches about high levels of bacteria making water unsafe for swimming.
Thank you, Tim. We'll now shift to a focus on the possibility of a regulatory moratorium being adopted in the 2015 Indiana General Assembly. As brief background on the matter of a moratorium, the Indiana General Assembly passes laws, and regulatory bodies like the Indiana Utility Regulatory Commission, the Fertilizer Advisory Board, and the Indiana Environmental Rules Board adopt regulations that may come from state statute or from federal statute. Now, policymaking historically in Indiana has been, with respect to Indiana policy, has been something that has been done both by the Indiana General Assembly as well as by Indiana regulatory bodies. That's a reflection of an appreciation of the specialization and training that Indiana regulators have, for which policy that may have a more technical aspect to it would be written and adopted by the regulators themselves. There may be a potential sea change in how policymaking is done at the state level if a regulatory moratorium is passed. A provision in the 2014 Indiana General Assembly Bill, HB 1005, effectively would have enacted a moratorium with respect to new regulations, with few exceptions. And with that background, I'll pose the first question to Dr. Frank. Indra, what's an example of a recently adopted safeguard that is focused on children that could potentially have been imperiled had Indiana had a codified regulatory moratorium in place?
Okay. Well, I would go with the school pesticide rule. This was passed in 2010 by our pesticide review board, the Indiana Pesticide Review Board. They spent a number of years deliberating before they actually put this rule in place. They were very, very careful and very cautious in their approach to it. But I think what they came up with does benefit the children of Indiana. The rule reduces the use of pesticides in schools and encourages non-pesticide means of controlling pests. It restricts pesticide applications to times when children are not present. So if pesticides have to be used, the school is required to notify teachers and parents ahead of time. They're required to use the pesticide only when the children aren't present. And if a pesticide is determined to be needed, it can only be applied at a school by a certified pesticide applicator. During that certification process, our applicators are required to undergo some education on health impacts, potential health impacts of pesticides. So certainly if a chemical needs to be used, you'd want it in the hands of someone who's been certified. That the Indiana Pesticide Review Board passed that rule in 2010. If we had had a regulatory moratorium in place at that time, they never would have. They were very cautious to begin with in putting it together, and as I said, it took several years.
Tim, a question for you on the same topic of the moratorium. How might a regulatory moratorium prevent Indiana from heading off the kind of tragedy that happened in Charleston, West Virginia earlier this year?
Jesse, what happened in Charleston happened in January of this year when an above-ground storage tank that contained a coal cleaning chemical leaked and spilled into the Elk River and put the drinking water for hundreds of thousands of West Virginians at risk and virtually made that drinking water unsafe for consumption. In response to that, the state of Indiana is considering changes to our state above-ground storage tank rules that would provide more information about the location and contents of these storage tanks and their proximity to drinking water systems. And these kind of improvements to our state rules would allow the state to be more proactive in making sure that that we're protecting drinking water supplies and making sure that tank owners are taking all the necessary precautions to prevent any risks to our drinking water supplies. And while these changes would be allowed under state law, a regulatory moratorium could prevent them from going forward and preventing our ability to protect our drinking water supplies and prevent the kind of disaster that happened in West Virginia.
Indra, want to revisit some of the the broader issue that you raised, and that is, what are other environmental rules that you think might not have happened that were recently adopted if a moratorium would have been in place?
Okay. Yeah, I've got a couple of other examples of things that I think are beneficial to Hoosiers' health, but that wouldn't have happened if we'd had a regulatory moratorium. For one of those, I'll reach back to 2006. The Department of Environmental Management went ahead on its own and recommended a rule to the Air Pollution Control Board, or no, I guess it was the Waste Board, having to do with mercury. It turns out that cars up until about 2004 or 2005 were built with certain switches in them that contained mercury. When those cars got to the end of their useful life, they often go for recycling, and we do have plants here in Indiana that recycle end-of-life vehicles. The problem is if the mercury switches are in place, the mercury either gets spilled when the car is crushed or evaporates in the heat as the steel is being melted down and winds up in the emissions of the steel foundry. The rule that IDEM went ahead with required that those mercury switches be removed from the cars before they went for recycling. So the mercury was being captured and controlled before it could be released to the environment. And mercury, as you may know, is really toxic to the nervous system. A single gram of mercury, and a gram is less than 1/400th of a pound, is a lethal dose for mercury. So it's something that we have better control on as a result of that rule. It's been estimated that somewhere between 75 and 150 kilograms of mercury have been controlled each year as a result of that regulation. And it was a regulation that IDEM carefully crafted and had the backing of the steel industry, but it couldn't have happened without the regulatory, or if we'd had a regulatory moratorium. Another example, a more recent one, was a rule passed having to do with outdoor wood boilers. There are people around Indiana that use these for heat or for hot water, but they can have serious impact on neighbors because they can generate a lot of smoke if they're not built correctly and run correctly. So a rule was put in place just, if I remember right, 2 or 3 years ago, that required that if someone was going to operate this, one of these devices, that there were some stipulations about how the device was built and how far away it was from a neighbor's house to help control what could otherwise be overwhelming amounts of smoke going directly into a neighboring house and impacting everyone, but especially those who have any respiratory illness or children who have asthma. And that's another one that we would not have had if there'd been a regulatory moratorium.
Great, thanks. Thanks, Indra. Tim, I'm going to ask you a little bit of a different question than one we had discussed, and that is really speaking to our need to be careful in how we characterize this moratorium, which is that it's fairly broad in its scope, but it does allow for certain exemptions, including emergency matters, health and safety. How do we square the spirit of the moratorium, which is essentially intended to slow down or potentially stop altogether new regulations with that provision, and how do you think that will actually play out in practice if this were to become law?
Jesse, the regulatory moratorium creates a great deal of uncertainty for our state agencies in undertaking the public health and environmental protection roles that are given to them by state law. And so the risk is that the ability of our agencies to respond to new circumstances and new technical or health-based information and modify existing rules and standards in place to protect health and the environment will be in question. And the practice in Indiana, as in many states, is that the legislature sets policy on environmental or health protection, and then the agencies are mandated to implement rules to carry forth those requirements, and that in many cases is an ongoing authority and responsibility for the agencies. And so some examples of where the state's, the agency's authorities could be affected, again, can relate to rules under our confined animal feeding operation statute or our oil and gas regulation statutes or electronic waste management. All of those are state programs where the laws have provided for our agencies to adopt rules, and the regulatory moratorium could be used to prevent new standards from going forward, even when they are clearly needed and warranted based on new information.
The second topic is no more stringent than. No more stringent than is a policy that would prevent or prohibit Indiana environmental regulators from adopting regulations that are more stringent than the federal government. So with that background, I'll pose the first question here to Indra, which is how might a proposed no more stringent than bill put communities at risk of being vulnerable to the kinds of concerns Americans are having related to fracking?
It's important to look at fracking as an example here because that's one place where there's exemption from federal regulation. Oil and gas exploration is exempted from the vast majority of federal environmental law. So this is definitely one place where it's left to the states or to local governments to decide whether any limitations or regulations need to be put in place. We don't have a lot of fracking in the state of Indiana. We have some, but I think what you're getting at is that there are places where federal law is either very limited or even silent, and the authority is left to the states to decide what best to do for their population. If we have in place a law that limits our state to only regulations as stringent as the federal regulation, it limits us to minima that exist with the feds, and it leaves open the question of what we do if federal regulation is silent. So one key example, I think, for Indiana would be regulation of the confined animal feeding operations. Industrial scale animal operations, as I mentioned, generate very large quantities of waste, the animal's waste, and currently that waste can go entirely untreated, and we often have spills that wind up in our rivers and waterways. So there's risk of contamination of drinking water supplies, risk of bacterial contamination. There are other states that have gone ahead with regulation either to protect water or to protect air when it comes to the animal wastes. If we have a no more stringent than law here in Indiana, we would be limited to what's in federal regulation, and federal regulation is almost silent when it comes to these types of facilities. So we would be very limited in our ability to respond. What we've seen with fracking, since you brought that up as a comparison, is in the absence of serious or significant federal regulation, there are counties and states around the United States that have decided what kind of protections they needed to put in place when the fracking industry was present or when it started to threaten local drinking water supplies. And I think similarly, because federal regulation is so limited, we need to leave open the option of doing something when it comes to protection from the animal wastes.
Tim, to look at another context for no more stringent than, how might no more stringent than legislation make it more difficult for Indiana to head off what happened in Eden, North Carolina, which, as you recall, was the second largest coal ash spill in U.S. history?
The significant absence of meaningful coal ash regulation is could be seriously affected by no more stringent than. And in Indiana, we're one of the largest generators of coal ash waste, and it's disposed of in very lightly regulated lagoons and landfills that are typically located over drinking water aquifers and next to our waterways. And as we saw in North Carolina, one of these coal ash lagoons leaked waste into the Dan River and created a huge water contamination spill that the state is still not sure of the total impacts of that spill. Again, Indiana has more coal ash lagoons than any other state in the country, and these lagoons are posing a serious risk to our drinking water supplies. So we could see a major effect if this policy went into effect in terms of the state's ability to protect Hoosiers from this very dangerous waste source.
Speaking of other risks to public health, you referenced pesticides, and I want to ask you a question on pesticides with respect to no more stringent than. Have other states acted in tightening their regulation of pesticides beyond the federal limit, and then what does that mean for Indiana being able to do that under a no more stringent than law?
Yeah. Okay. Well, pesticides do have regulation at the federal level, but as with many other regulations, the federal limits are meant to be minima, and it's left to states and localities to decide if they want to go further. So I'll give an example of a chemical called methyl iodide. Methyl iodide is a fumigant. Methyl iodide, after it's a liquid when it gets applied, but after it's in the soil, it easily evaporates into a gas. And of course, as a gas, then it gets blown in the wind, and it's virtually impossible to control exposure. If methyl iodide is inhaled or absorbed through the skin, it can cause nausea and vomiting, dizziness, but with higher doses, it can cause more serious consequences like loss of coordination and slurred speech. California's Department of Pesticide Regulation banned the use of methyl iodide. They decided it was just too hazardous. So that was one example where there was federal regulation, but the state had the option of deciding that this was something that they wanted to go further on. If we have a no more stringent than law, we take away one mechanism for our own citizens to bring issues to regulators and ask for additional protections.
Taking the issue a little bit more broadly from the specific concern with respect to pesticides and fracking, Tim, I want to ask a broader one, which is how might either a potential no more stringent than law or a regulatory moratorium that is codified into law affect the ability of local governments to move forward with safeguards?
Well, Jesse, that's a very good question in that it again points to the uncertainty created by a regulatory moratorium or the no more stringent than policy. For local governments, when they exercise public health or their zoning powers, those powers are authorized by state law, and so in the case where a local government unit adopted public health or zoning ordinances that were considered more stringent than comparable federal law, those, given the uncertainty created by these policies, those local government actions might also be challenged as not being in compliance with either violating the regulatory moratorium or the no more stringent than policy. One example could be zoning requirements put in place by a city or town or county to protect or to establish a wellhead protection zone for underground drinking water sources.
Wrapping up this section on discussion of no more stringent than, a final question to you, Tim. How do you think this concept of no more stringent than squares with the general philosophy of policymakers in Indiana with respect to home rule or local control?
Well, Jesse, this is the irony of this whole effort to impose a no more stringent than policy in a state where a conservative state where our leaders prefer to have, state control of state matters. By tying the hands of our state agencies to react to Indiana-specific problems and conditions, Indiana, by adopting this no more stringent than policy, is actually inviting more federal involvement in state regulatory affairs because the state is tying its own hands to take the actions needed to protect Hoosiers and their health and our environment.
The final policy topic that we'll be discussing is the budget. The budget in Indiana that runs Indiana state government is adopted every 2 years. And the 2015 session of the Indiana General Assembly will spend a lot of time focused on the budget. About less than 1% of total spending is actually attributable to the environment at large, whether that's with respect to safeguarding the public health from pollution or protecting open spaces. That amounts to about $47 per Hoosier. The particular spotlight we want to put when it comes to the budget is with respect to that related to the Indiana Department of Environmental Management, which is effectively the state EPA. And IDEM has sustained a 10% cut in its budget compared to pre-recession levels. In the upcoming legislative session, the current administration has proposed an additional 3% cut in IDEM funding. So that backdrop, I'll ask our final question to Tim. Tim, how might sustained budget cuts in terms of reduced staffing levels or technical assistance put Indiana in a worse off position to head off environmental risks, whether those that we discussed in the Indiana context or those that we discuss in the national context?
Well, Jesse, given that our state agencies, environmental agencies, start from such a very modest point in the beginning, just being only 1% of our state budget, any sustained budget cuts that happen year after year, which is what's been happening with the Department of Environmental Management and the Indiana Department of Natural Resources, it definitely affects the ability of our agencies to maintain a well-trained and experienced staff and replace vacancies when they occur, again, with new qualified staff. One example of this that is happening at the Department of Environmental Management is that the state's water quality monitoring program has a 30% vacancy rate in staff brought about by our hiring freeze that, again, is a result of the biennial budget cuts that the Department of Environmental Management has been experiencing. So without accurate and up-to-date water quality monitoring data, the state's ability to maintain and undertake an effective water quality protection program is reduced. From the standpoint of technical assistance, a very successful state program known as Clean Water Indiana has seen budget cuts of $1.5 million over the past several budgets. And this is a successful program that provides assistance to farmers to reduce the erosion and sediment that's coming off their lands, and again, that affects the quality of our state waters. And then another example that that the public might not connect with a public health issue is one of the Department of Natural Resources programs. Their deer research program has been cut over the years, and this affects the ability of the state to know whether chronic wasting disease, which is a very deadly disease for our native white-tailed deer, might actually have an effect on human health. And right now, wildlife biologists and health professionals don't know if that's the case, but given that thousands of Hoosiers consume deer that they've taken from our wild deer herd, it seems like that's a question that we definitely need to have answered, and the state's ability to answer that question has been limited by these budget cuts.
Given that we've spotlighted the kind of public health footprint of confined animal feeding operations in Indiana, I want to another question related to the budget has come to mind, and that is whether we have adequate staffing levels with respect to inspectors who go out and look at these 2,000 plus large-scale confined animal feeding operations.
Right now, about each confined animal feeding operation is only inspected about once every 5 years, and that provides a lot of time for problems to occur before a state inspector returns to that facility. So that situation and low level of inspection regularity simply can't be improved without adequate budget resources. So that's another example of how the agency's ability to do its job in protecting health and the environment has been limited by these budget cuts.
Great, thanks, Jim. We've appreciated the opportunity to engage you on the topic of environmental health. And as private citizens, we encourage you to do three things to stay engaged on this essential topic. One is to go to Facebook and look up Hoosier Environmental Council. And if you follow us on Facebook, you'll get an opportunity to learn about issues related to Indiana's environment and its repercussions for public health on an often daily basis. Similarly, we encourage you to follow us on Twitter, where our handle is HEC_ED. Finally, we hope that you will visit a specific page on our website, hecweb.org/BillWatch 2015. So we hope that we continue to be engaged with you as being a resource to the public health community. And before we adjourn for this session, I want to introduce Dr. Stephen Jay to give some concluding thoughts.
Thanks to the members of this panel. I've learned a lot. It's very stimulating, challenges and opportunities. I guess I'd start in summary by just suggesting some good news, and that is the benefits to Indiana as well as the country in terms of regulations, legislation at both the state and federal levels, designed over the last several decades to improve the overall quality of air, water, soil, food, and the like. And we have excellent evidence now that indicates that those measures have dramatically improved the health and the quality of life of Americans and Hoosiers. That's the good news. The concerning news is what I've heard this morning, and that's regarding the concern of the anti-regulatory environment that has been brewing in Indiana as well as some other states, and that are to public health and people concerned with the environment, to these professionals, presents a pretty significant concern. The problem in terms of what we're talking about today is the scope of the challenges that we have simply require regulation at a state, a local, a state, and federal levels. And so the public policy that results from such review and through legislation has to be informed, it has to be evidence-based, it has to be driven by science and not just politics or partisan issues. So we need professionally trained, and we're in the business of educating health professionals, we need to have professionally trained people who can participate in reviewing and helping legislators and community leaders and industry leaders understand the public health and environmental threats. And finally, I would just echo what Jesse mentioned, and that is we individually need to be involved every day. By we, I mean health, public health, and environmental professionals, in advocating evidence-based policies. It's critical. Yesterday, I took my turn. I was down at the State House, and we met. But every day, I urge students to do something. Ask a question of your legislator, your policymaker. Put a couple of references together and just pose an issue. But get involved. That takes a couple of minutes, 3, 4, 5 minutes. So it's all within our power to do it. So with that, let me conclude.